Thank you, Dr. Pappas, for sharing with us the status of HIV/AIDS in the district. I want to take a moment to acknowledge the Ambassador of Grenada, who is here with us today, Ambassador Bristol. Very pleased to have you. Thank you for joining us. All right, next I'd like to welcome Dr. Grant Colfax, who is the newly appointed Director of the White House Office of National AIDS Policy. In his role, he's the President's lead advisor on domestic HIV/AIDS policy and is also responsible for coordinating HIV/AIDS policy issues for the Domestic Policy Council. Now, prior to his appointment, Dr. Colfax was the Director of HIV Prevention in San Francisco's Department of Public Health. So, ladies and gentlemen, let's please welcome Dr. Colfax.
Well, good morning, everybody. Good morning. So it's wonderful to be here, and just want to extend my thanks to Howard for hosting this event, to Lisa and the Congressional Black Caucus Foundation for their ongoing support in this fight in the epidemic, and most importantly, to thank all of you. This is really how we're going to get the work done, by science, public health, community, coming together to fight the epidemic. Tomorrow is World AIDS Day. Time to pause and reflect, to remember the many, many that we've lost, and also to reflect and to think about how far we've come. Think of the days in the early 80s. Think of the times of Ryan White, where people were dying and hope was all we had. We still have hope. And we have more than hope now. In fact, we are at a tipping point in the fight against AIDS. We have the opportunity, and we need to seize the opportunity of an AIDS-free generation. Think of how far we've come. In the United States, maternal child transmission has dropped by 90%. Due to comprehensive prevention efforts, hundreds of thousands of HIV cases have been prevented. And now we have life-extending treatment so that somebody who's diagnosed with HIV early, who receives these medications, can be expected to live a near normal lifespan. Remarkable shifts, remarkable changes. And at the same time, just as in the days of Ryan White, stigma and discrimination continue. Stigma and discrimination are critically important to address as we continue to increase testing, linkage to care, and treatment rates in people living with HIV, both in this country and abroad. We have a long way to go, but one of the things that President Obama prioritized in the administration is to move forward domestically with reaching tangible goals for HIV prevention and treatment. That's why under his administration, we issued the first comprehensive national HIV/AIDS strategy. The first comprehensive strategy, nearly 30 years into the epidemic. 2 years ago, the President released a strategy which has 3 health outcome goals: to reduce new HIV infections, to improve health outcomes for people living with HIV, and to reduce HIV-related disparities. Very importantly, the strategy looks at the data and calls for concentrating resources in our efforts in populations in the United States that are most affected by HIV. These populations include gay men, blacks and Latinos, and among women who account for 23% of new infections, especially among women of color. Women of color represent nearly 3/4 of new infections among women. Yesterday at the White House, we had a World AIDS Day event, and it was a remarkable event of again, people living with HIV, community, scientists, politicians coming together to get the work done. I was humbled, particularly by the youth who were on the panel, youth living with HIV, who talked about their experiences, who talked about stigma, about discrimination. But what was most empowering about the discussion was their strength, their resilience, their commitment to moving forward, their commitment to talking to their youth, their peers, their refusal to accept the stigma and discrimination that still surrounds HIV, And with the youth moving forward with this commitment, talking about it, keeping it alive, making sure people realize that HIV is still a problem, and also realizing that there's so much we can do to get tested, to get treatment, to keep talking about it. It was just a really, it is one of those things where you're just so inspired. And all of you today have that opportunity to continue to move this forward. The piece around stigma and discrimination is critically important also as we think about the testing and treatment cascade and the opportunities that we have to increase testing and treatment. The Affordable Care Act, for instance, is increasing opportunities for HIV testing for millions of Americans. In terms of the HIV care and the care cascade that Dr. Pappas talked about, tens of thousands of people living with HIV will be able to access health care coverage because of the Affordable Care Act. Now, we obviously need to make sure that this promise is realized, and that's one of the things that I hope that many people will be talking about later today. How do you do that in the context of where there's still stigma and discrimination? But just as a couple of examples of how we have moved forward with regard to stigma and discrimination regarding HIV, we had the International AIDS Conference here in July. The reason we were able to have that conference for the first time in 22 years is because the Obama administration lifted the entry ban on people living with HIV. A very, very important piece. Another example, and this is again tied in with the Affordable Care Act, is insurance companies in 2014 will no longer be able to not provide coverage for people who have pre-existing conditions. So as some of you providers and people who talk to people about getting HIV tested, I've had many conversations with patients who do not want to get HIV tested because of the stigma associated with HIV, and they're afraid that they would lose their insurance coverage or not be eligible for coverage. In 2014, that's not going to be the case. So again, a huge step forward in addressing the stigma and discrimination. So I want to thank you as we collectively move forward towards an AIDS-free generation, and just say that as we look towards this vision and we think about all that still needs to be done, that I thank you for your commitment. It's not going to be easy. It's going to take a lot of work, but we're at a tipping point, and I hope you'll join me and the administration to realize the promise that we have together. Thank you so much.